Good evening, everyone. My name is Dr. Prateek Joshi, and I am an assistant professor in orthopedics at BJ Medical College and Sassoon General Hospitals in Pune. Now, the reason for keeping this session is that most of you are now in this phase of life called the final countdown, which means you are just a few days or maybe a week away from a really important exam, which right now is the final MBBS examination. So, this is a special session from our YouTube channel, that is Rapid Revision of Orthopedics by Dr. Prateek Joshi. And the session objectives are as follows. Firstly, we'd like to execute a quick roundup of last minute preparation strategies for your exams, with special reference to final MBBS students who are exam going right now. Then I'd like to put across a certain few do's and don'ts which you can follow during your last minute preparation as well as while you are writing your paper. Then we'd like to go over a strategy for time management so that you can time your paper properly, you do not end up missing out on anything, and you do not have any unnecessary allocation of time where it is not going to give you an output, which means that with the limited time you have to prepare now and the limited time that you will have in your paper, we would like to maximize the output here in terms of marks. And most importantly, of course, you guys don't have a lot of time, and therefore I'd like to keep this a short and sweet session, and I'm trying to finish under 20 minutes. Now I am recording impromptu as we speak, and therefore let's see how that goes, but this is not going to be a very long session. So let's get on to the actual topic at hand, which is the final countdown or the last minute preparation for your exam. Now, most of the times in this phase of life, it is very common, or it is very likely, that you will be feeling like you're hanging off a cliff. You've climbed all the way up to the mountain and you can see the valley in front of you. You know that you're supposed to jump in at some point, but you're afraid to jump. You don't know what will happen when you jump. You might fall or you might fly, and there's no way to know, and that is what is building up the apprehension, and therefore you often feel like you're hanging off a cliff. Now, this year has been a difficult year for everybody, for the frontline workers in COVID-19, and of course for the students who had to compromise on a lot of clinical learning. And for the compromise of clinical learning, there has been a overdose of online teaching. So there are webinars here and webinars there, and at one point it was feared that the second wave of COVID-19 would be very small as compared to the second wave of webinars about COVID-19 and online teaching. And all jokes apart, it has been a stressful year for most final MBBS students, that also for your third minor students as well. And therefore it is a different dynamic and a different mindset with which you will be giving this exam. And please note that on the other side, that is your examiners and your faculty and your teachers are also aware of that. So although it is a stressful time, please do remember that everyone on the other side completely understands and empathizes with your situation. Moving on, now what we need to do in the last few days is complete strategy. Please remember that the last few days of the exam are where you have to fine-tune your efforts. Whatever you remember in the exam and whatever you write in the exam is based on what you have studied all year and not what you are going to do in the last few days. What matters from the last few days is the way you are going to stratify your preparation, the way you are going to focus on things which have to be done, and the way you are going to divide your time properly. That is where strategy comes in. So let's just take a look at what you're going to do for your last minute revision. Now, last minute revision, remember, the human mind has a tendency to get attracted to certain topics, and therefore you may find yourself revising a couple of topics more importantly or more frequently than others. But please resist this temptation. Focus on high yield topics and broad topics such as your tuberculosis, vasculitis, so on and so forth, where doing one large topic will cover more of your questions as compared to, say, a small and fancy and rare topic, which in itself will have a lower probability of being asked in the exam. Second is that weightage matters, which means that topics which have a greater amount of weightage or a greater amount of frequency of being asked in the exam are more important for your final day's preparation. Also, please go through your past year examination questions. Majority universities have a book or have online resources where your final MBBS or your past question papers are available. And when you go through those papers, don't just read the papers, try to look for a pattern. Try to look for what kind of questions are being asked, what kind of topics are being tested. Now, there are some universities which would like you to go more on a theoretical line. There are some universities which design questions based on your clinical scenarios, or they try to design questions in such a fashion that they want to see how you will face a clinical or real life scenario as compared to just being able to write an answer. Of course, these are different strategies across different universities. Now the YouTube channel on which this is going to be uploaded has about 3000 subscribers from all over the country, so I cannot really specify one particular university. But to give an example, Maharashtra University of Health Sciences, MUHS, where in Maharashtra, where I am based, it is a fairly stratified paper, and the papers are available with students. The past year's papers, recall questions, are available with students, and they tend to follow a set pattern, and therefore it is in your interest to try to figure out what kind of pattern the paper setters are following, and you would like to prepare according to that pattern. More on this later. Now the question is how to go about creating your last minute timetable. Now, the best and the simplest method which I used when I was in my final MBBS and when I was preparing for my MS Orthopedics exam as well, is that the number of hours dedicated per topic should be proportional to its relative weightage and to the relative number of times that question has been asked. So the more frequently a question has been asked, or the more is the weightage, the more time you can dedicate. Now, from MBBS point of view, firstly, decide the number of hours you are going to be planning to put in per day. So if you have some sort of teaching activity going on in college, or if there is some sort of a crash course or some online test which you are giving, then deduct those many hours and first figure out how many hours are available to you, counting your sleep and your relaxation, and then use simple unitary method to allocate subjects. So medicine and surgery have the highest amount of time, followed by obs gynae, followed by pediatrics, and then the other small subject, and therefore you can just calculate using a ratio and proportion or a unitary method based on the number of marks of that subject to allot the number of hours per day, so that you don't underexpose or overexpose yourself to any particular given subject. Now, another thing which I was very used to and something which helped me out even in my MS preparation days is something called as a tally marker technique. Now this is something we have learnt in school. This is the use of tally markers, which means that every time you are going through your papers, your past year papers, and you see a question being repeated, put a tally marker in front of it. Every time you see the question repeated again, put another tally marker, so on and so forth. And so it will provide you a visual representation of the number of times that question has been asked, which means it is difficult to attach a number to a particular question, which means that it is difficult to say that tuberculosis has been asked 15 times or vasculitis has been asked 12 times. But if you see a long list of tally markers, it fits that topic in your brain, that this is an important topic, and therefore subconsciously when you are revising on the day before the exam, you will find yourself flipping to that page in your notebook where you have written about tuberculosis or you have written about vasculitis. So it is more about creating a visual memory for the frequency or the weightage of a particular topic, and therefore just put a tally marker, and the more the number of tally markers, obviously the more is the weightage or the more is the number of times that question has been asked, and therefore you have every business to revise that topic before your exam. Moving on now to formatting an answer. So firstly, remember that an answer is an essay, but an essay is not just a block of text. You are trying to explain something, a topic or a concept, to an examiner who's sitting far away, who doesn't know who you are and who does not know how much you have read, but you want to put across the information that you have in the most concise, in the most clear, and in the most compact fashion without creating too much of a confusion. And therefore you would like to divide your answer into proper headings. So you would like to have a heading called introduction, epidemiology, pathophysiology, etiolopathology, clinical features, treatment, management, complications, so on and so forth. If you know some recent advances regarding a particular topic, say if you have osteoarthritis of the knee, and then you have chondromalacia patelli, and then a recent advance of this is gadolinium enhanced MRI scan of the knee joint, which allows for cartilage mapping, so something like that. So if you have this kind of extra information, you can always put it. What is important is to stratify and divide your information or your essay into proper headings. Not only does it make the answer look good, it also puts across a non-verbal message to the examiner that you have a good thought process, or you have a clear and concise line of thought, and that reflects very well on you while your examiner is correcting the paper. Now also estimate your answer length. This depends on the university, whether you get supplements or you get a single large paper. In Maharashtra University, the trends are different, so the final MBBS students, you can just find out how much is that exam paper and how many pages you get, and please divide that answer paper so that you end up giving a good amount of weightage and a good amount of page space to each answer proportional to the amount of marks that are expected from you. Now this is something which you have to do, that is time yourself, which means that it is easy to recall a particular topic, but how good or how fast are you while you are writing it? And this timing has to be done in peacetime so that you don't run out of time during the final battle. So please try to practice writing at least one or two answers over the next few days, one or two short answers and one long answer question every day till the last day before your exam. So that will get you in touch with the paper. Most of this year has been online education and online exams, and therefore not everyone is used to writing that much, and you need that kind of practice because your final exams are probably likely to be offline, and therefore you need to have the practice of keeping your pen on the paper. Remember, writing an exam paper is not only a performance art, but it is also an exercise in physical endurance, and therefore you have to be used to it. So time yourself and give yourself the amount of energy that you require, and practice for that in peacetime, that is the days before the exam, so that you don't run out of minutes or you don't run out of energy during the final battle. And always remember that when you're writing, try to put in as many diagrams, as many flow sheets, and as many well labeled illustrations as you can. And when these diagrams and flow sheets are being drawn, please make sure that you're putting a small index or putting a small legend, so that the examiner does not have to waste time in figuring out what this symbol means and what this arrow means. The bottom line being that you have to help the examiner help you. The easier you make it for the examiner to assess your paper, and the clearer you make it that you have a good thought process, the better you're going to score. This applies across all examinations, across all universities, and across all subjects. Okay, this is a principle which you should not forget. Now while we are on the topic of diagrams, let us just go over the acceptable color codes. Please remember that colored pens, highlighters or crayons are not allowed in majority universities. However, you are allowed to use standard HB color pencils. So you can use black color for bone, skin and outlines. You can use red for arteries, blue for veins, yellow for nerves, brown for muscles, and green when it comes to tendons or ligaments or any collagenous fascia. And of course, over and above that, if you are using your standard hematoxylin and eosin or HNE pencils for histology diagrams, that is also perfectly acceptable. So these are the acceptable color codes. Remember, these refer to color pencils and not colored pens or highlighters or crayons or even sketch pens. Those are not allowed. Okay, moving on. Now this is a concept which I found very useful, and that is called the law of solitary conduction. Now if we remember from our first year physiology, solitary conduction refers to a impulse which travels around a nerve, jumping from node of Ranvier to node of Ranvier, and because of that, the overall speed of traveling of that impulse is much faster in a large myelinated nerve fiber as compared to a non-myelinated nerve fiber. Now the reason I'm giving you this concept here is that you have to make sure that when your paper is being assessed, the examiner goes through your paper like a neuron or like a impulse which is traveling across node of Ranvier to node of Ranvier. So underline your keywords, catchphrases, technical terminology, so on and so forth. Make sure they are very noticeable and they jump out of the exam paper and they are seen by the examiner with proper line spacing. Now the human brain may not be consciously trained in objective question paper making, but the brain does work by jumping from one object of attention to another. So it is your prerogative to make your keywords, catchphrases and technical terminologies noticeable so that the examiner can go on correcting your paper and making it easy for the examiner to correct your paper. Once it is easy for the examiner to correct your paper, you will score better. Okay, let me give you an example here. This is a question paper from an online exam which I corrected. Now this is a huge block of text and it's going to take me some time to read it, whereas this is another question another student who has written. Now see how this particular student has written their question number. The handwriting is better, the presentation is better. I can see some amount of little points here, and I can see bullets, I can see a nice percentage, I can see a number, so on and so forth. So my eyes are likely to jump from one object of attention to the other, and I will end up marking this paper slightly better even if the content is the same across both the papers. Now I'm not saying that this is fair, but this is how subconsciously everyone works, and therefore it is up to you to use this little tongue-in-cheek tactic to your advantage. Moving on, now while you are writing the paper, time management of course is of paramount importance in the exam hall. So just like you used unitary method to find out how many hours per day you are supposed to dedicate to say surgery or medicine or obs gynae, similarly use unitary method to find out how many minutes you can give for a long answer question and how many minutes you can give for a short answer question. Now most university papers are freely available, and therefore you guys must be familiar with the format. So therefore I strongly recommend that this is not something you should sit and calculate in the exam hall. You should have these numbers and figures ready before you are writing the paper. Also please answer the long questions first. This is assuming that you have the freedom to choose the sequence of questions. If the question paper is instructing that the questions have to be attempted in sequence, you have no option. But if you have an option to attempt any question in any sequence, then please attempt your long answer questions first, because it is human nature, it is the way our brains run, that we tend to attempt the best known question first, and we try to do a really good job at it. We end up investing more time into that particular question, and therefore might as well do a question which is going to fetch you more marks. There is no point in wasting the first 25 minutes of your paper on one short answer question if it's just going to fetch you 3 or 4 marks. Okay, similarly diagrams and flow sheets will take a precedence over the text, because diagrams and flow sheets, they punch out much more information in that same amount of space and in the same amount of time than a similar block of text, and therefore it is not only a more concentrated amount of information, it is visually appealing, and it proves that you have a good thought process and you have a photographic memory, and this will of course reflect much better when you are receiving your marks. Now something that everyone makes a mistake in is called as an overinvestment paradox, or the bird in hand is worth two in the bush. Remember, bird in hand is worth two in the bush works only when you are catching birds and nothing else, which means that you have to attempt every single question. You cannot tell yourself in the exam hall that I know this question better, let me write this question beautifully, and then I will just write something for the other questions because I don't know them that well. Okay, so you have to attempt all the questions, and therefore do not over invest your time and energy on one question. Please follow the unitary method time scale so that you can devote a equal or a proportionate amount of time to every question, because you will never get more than the maximum amount of marks allotted to that question. Just because you have written a good answer does not mean that you will get 10 marks out of 8. You will get 8 out of 8 at maximum, or 7 out of 8, and therefore you have to put a stop to it when you reach the end of the allotted time, and you have to move on to the next question so that you do not leave any question unattempted. And of course, as we've been talking all about, presentation and neatness is the key. Now before we start off on the last part of this session, a lot of queries have been coming in about how this trend of examination will be different in terms of the COVID-19 pandemic. Now I am not a question paper setter for any university, and therefore I am not in the position to give any sort of a official statement, but remember that all of you students are in the same boat, be it in Maharashtra or be it in any state all over the country. Apart from that, a lot of clinical exposure has been lost in the COVID pandemic, and remember that your teachers are well aware of that, and therefore whenever you attempt your practical examination, the practical examination format is likely to be such that you would not face a huge loss by the loss of clinical exposure. But that being said, theory paper will be a very good standard of examination, because you are expected to have studied over the course of the lockdown, and therefore please do not take the theory paper lightly. Please study well, please write well, because theory paper is of paramount importance and you have to do well in your theory. Okay, Moving on, please take care of your circadian rhythm. Remember, human body is a machine. It's a very complex and a very sophisticated machine, but a machine all the same, and machine needs its rest and machine needs its refueling, and therefore maintaining a circadian rhythm, sleeping at night good 6 to 7 hours is something which you cannot miss out on. Now, here is something called as the 10% paradox, which means that in any question paper or in any exam, there will be 10% of the questions which you have absolutely no idea about. Okay, probably even Einstein couldn't solve that kind of a question, because the medical science is so vast and it is so rapidly expanding that there is always something that you have not read and there is always something you have not heard about. So please don't be worked up, or please don't be frustrated when you get a question like this. Please remember that the person who has set your question paper is a very experienced and a very senior teacher, and therefore every person will have something or the other that they can write, and you will not have a lot of questions which are absolutely Greek and Latin, and some amount of very difficult questions are expected in every exam. That is how exams run, that is how it works. So don't get worked up by that 10% of the question. Focus on the questions which you know well, and focus on writing them well and presenting them well. And of course, your time management. Of course, this is a difficult time. COVID-19 pandemic has taken a toll on pretty much everyone. There's a lot of doubt and fear, but to quote one of my senior teachers, who used to always tell us that easy does it, which means this is not a time to slack off, or this is not a time to lose your rein, but this is also not a time to consciously stress out. And remember that everyone is in the same boat as you are. Now, of course, you must have started your preparation long ago by thinking that impossible is a huge thing, and you could fail, or you could not do well, so on and so forth. And as you started studying, you would realize that nothing is impossible, and you're slowly making strides, you're slowly climbing that mountain. And of course, everyone is making progress, and everyone is going to do a really good job in this examination, and it's just a matter of time, and it's just a matter of perseverance before your quotation of nothing is impossible changes to impossible is nothing. So thank you very much. I really enjoyed talking about these final MBBS exam tricks, and I hope you enjoyed listening to this lecture as much as I enjoyed giving it. So my email is in the channel information. You can get in touch over Facebook or Instagram or any social media, and I'm always available to answer any kind of doubts which you may have. So thank you very much for listening, and I hope this session was really useful. Thank you.